Chemical peels or a laser in darker skin? Let's talk about it. So there has been a lot of recent interest in the power of chemical peels and lasers. Make no mistake, they are great for reversing time, repairing years of sun damage, and addressing any uneven pigmentation or tone. We've all heard the horror stories of people posting about how they got chemical peels or lasers and had a major disaster afterwards. And truthfully, the fear is real. Chemical peels and lasers have a higher risk in darker skin patients. So let's do a little bit of a deep dive into each of these treatments, and I'll share with you what I think is better. So why is dark skin different? Well, the answer is melanin. Melanin, which we actually all have, whether you're very fair or very dark. We all have melanin. And the question is, how active are our melanocytes? For darker skin folks, they tend to be active. And for lighter skin folks, melanin is responsible for skin pigment. And it is also what gives darker skin people a high degree of resistance to UV rays and the damage that can come from them. It's a great sunscreen. So while darker folks are more resistant to tanning, one thing that melanin and melanocytes do is that they are more sensitive to damage and injury. Think of a pimple, think of a cut. If you are a darker skinned person, you most likely, after this pimple that was already an insult to your face, had what we call post-inflammatory hyperpigmentation, a further insult, or PIH. As they react to injury, they pump out extra pigment and create darkness where there was once some form of trauma to the skin. So this is what can happen when chemical peels and lasers enter in the mix. They inherently create some measure of damage or injury. And the question is, how does the skin respond to that? In darker folks, it can produce this same hyperpigmentation. And in some cases, it can actually produce hypopigmentation, so making you much lighter, or to some extent erasing some levels of pigment, and it's very hard to reverse. So what are chemical peels? Chemical peels are usually acid solutions that fall into one of three categories: superficial, medium, and deep. Those correspond to the levels of skin that they actually penetrate. They will exfoliate these layers of skin and increase cell turnover, which ultimately creates new skin that has improved texture and tone. Superficial chemical peels are usually considered the safest. They are gentle acids, think lactic acid, mandelic acid, salicylic acid, even some strengths of glycolic acid can all be considered superficial peels. Sometimes you can even find them over the counter in very small concentration. But I would still caution you that you should only use them under the guidance of a board-certified dermatologist or plastic surgeon. Still, they are pretty safe, carrying a lower risk of dyspigmentation, and are good for mild dyspigmentation issues. Medium peels are more like TCA peels, and these for sure only used with an experienced provider. Then we have deep peels. When we think of deep peels, we think of phenol peels, and those are an absolute no-no in darker skin. They are very aggressive. They incite a lot of inflammation and can leave you with a large amount of scarring and hyperpigmentation. The key for chemical peels is to go low and slow. Start superficial before kind of delving deeper. And also realize that for either chemical peels or lasers, you will likely need more than one session, on average 3 to 6 sessions. That should also tell you to go gently and do not try to do too much in one setting. How about lasers? Lasers are a focused beam of light, and depending on the wavelength, they can have different targets, whether it be water, melanin, or blood vessels. To treat hyperpigmentation, like in the case of melasma, laser actually targets the melanin and destroys it. Lasers have a little bit of an advantage. They are more powerful and more precise than chemical peels. And it's very important that for darker skinned people that you go to someone who has experience with a full breadth of lasers and knows which laser to pick for you. Here's some big no-nos. Do never be convinced to use or be treated with an ablative laser. Much like a deep peel, it's way too aggressive, way too harsh, leaves tons of scarring, and will almost certainly lead to dyspigmentation if not used by a trained provider. Non-ablative lasers are much safer and can be equally effective. They typically work by creating columns of damage, but they're still surrounded by normal tissue. And so in doing so, they stimulate collagen and break up increased pigment without destroying the skin surface. Good lasers for darker skin include things like erbium diag, pico lasers also are increasingly becoming popular for darker skin. They tend to produce less inflammation but also maintaining some levels of good destruction of hyperpigmentation. And so in that case, produce less scarring and post-inflammatory hyperpigmentation. Which is better? In terms of safety, I would say a superficial peel is probably the safest way to go if you have darker skin. That being said, superficial peels are not that effective at addressing really bad dyspigmentation issues. And so if you were looking at things like melasma, probably a superficial peel will not be as effective in treating that. Acne scarring, post-inflammatory hyperpigmentation from acne scars, I think it will do a very good job. But again, you want to go low and slow and remember to repeat sessions as needed. If you have a more stubborn issue like melasma, then laser is probably the way to go. But again, for either case, you want to remember that the provider is the biggest factor that stands between having a great result and having a really bad result. In this case, trust only in board-certified plastic surgeons or dermatologists. Ideally, you would pick someone who has worked with people of your skin tone before, your skin color before. And no matter what, believe in sunscreen and believe in hydration, especially after a treatment. What kinds of questions should you ask your provider, your board-certified provider? One is, you ask them simply, what do they recommend for you in terms of chemical peel or laser? What kind of peel will they use? What kind of laser would they use? This will give you a clue as to whether or not they're thinking or they're experienced in people of your skin color. And you should also ask them if they have any protocols, pre-treatment and post-treatment, that will help to avoid hyperpigmentation. Common pre-treatment protocols include things like using hydroquinone, retinol. These are the kinds of things that you want to hear from a provider that lets you know that they have some knowledge about this and that they will do well by you. Have you ever been burned figuratively and maybe even literally by a skin treatment that wasn't made for you? Please leave your experience below in your comments below. All questions below as well. Please like and subscribe. And as always, love you lots and bye for now.